the possibility of trying his own method once Marie's method fails.
I guess that's one of the ways to keep father interested, that should mother fail in her attempt to help the son, his own solutions would kick in. By sequencing the solutions that way, we hope to prevent a power struggle whereby father and mother are simultaneously competing for whose solution is going to work, thus, therefore, nullifying the effect of the hierarchical moves.
The idea also of encouraging the parents to focus on their son's behavior rather than to focus on their marriage may seem evident or obvious to most of you, but it's hopefully to relax the couple and to not get derailed from working on Jimmy's problem by erupting into a marital conflict of sorts.
If you ask why we decided to start on mother's solution, the answer is that she is much more involved with Jimmy, much more involved in the symptom, and therefore, as long as we kept father somewhat interested through some tasks, we felt like we could get better cooperation from the family.
Dr. Corrales and Dr. Rotrock, in conclusion, offer summary thoughts in relation to strategic family therapy.
Turning from discussion specifically of the family, perhaps now to looking at an overview of strategic family therapy, both in terms of its strengths and limitations.
The first strength that we'd like to highlight is the idea that there's a certain clarity of thinking about the problem and the solution that's very refreshing in strategic therapy work. That it tends to be results-oriented, as we've mentioned earlier. There tends to be a high level of accountability for results, which is quite refreshing in our work, because much therapy, a great deal of therapy doesn't really do that.
I really like that clarity portion because it not only clarifies the thinking about the family, but I know in doing some of the work strategically, it clarifies my own position. And when I, as a therapist, am very clear about what I'm thinking and what I'm suggesting, I think the work with the family goes much better. And certainly that is one of their strengths.
It's axiomatic that so much of psychotherapy is so vague and so ambiguous that even when you get success, it's very difficult to know what it was that created the success, and in cases where it's failed, it's hard to know what you did or did not do that led to the failure.
And secondly, there's a lot of emphasis on the therapeutic system as such, the kind of interaction that goes forth between therapist and client, rather than just an over-focusing on what's going on out there with the family. The therapist is included in the unit of analysis, thus leading to much greater flexibility when to give directives and when to give perhaps more prescriptive injunctions like paradoxical injunctions.
Closely related to that is an advantage that in strategic therapy you're much less likely to do harm to the patient, if you want to look at it like that, that you don't keep them around forever, for one thing, so consequently there's not unhealthy dependencies that tend to develop between patient and therapist.
I guess you and I have seen so many casualties among patients where they were labeled and given a very bad frame, something like narcissistic or other frames like that. In strategic therapy, therefore, there's much less of a chance of coming up with a bad frame, a frame that's not useful, and that certainly is one of its strengths.
Another strength we might highlight would be to mention that because of its brief nature, the therapy tends to be highly affordable to a large number of people. And since strategic therapy was somewhat of a reaction to psychoanalysis, and psychoanalysis tended to have many shortcomings, and one of those was expense. If you met with the patient 3 or 4 times a week, could become quite expensive.
For the next 10
For the
years.
next 10 years, then it could be quite expensive. So even at the current rates of $70 to $90 per session, psychotherapy tends to be quite affordable and effective, used in the strategic mode for large numbers of people.
Now, like all models, a model is designed to guide our own thinking and our own behaving in such a way as to help us map a territory. There are, however, some blinders. And one of those is that the over-focusing on a symptom and symptom resolution will often get a strategic therapist defocusing somewhat on the family system as it is structured. And we had the case very recently of an 8-year-old girl, if you remember, who said, "I have nightmares, and if my mother would only let me sleep with her at night," the mother was divorced, that the nightmares would go away. And we were convinced that if she did that, the nightmares would go away. However, systemically, the structure of the system would be worse off, and potentially, possibly, that family could go on without symptoms till the girl is about 13.
Just to build on that point for a moment, is that it's possible to argue that strategic therapy is sometimes too lean, that there's not enough of an appreciation for one's history or a family's history and how that history can be used constructively in the therapeutic process.
Another point, Larry, would be in the area of accountability or responsibility. Now, I know we mentioned that accountability is in fact one of the strengths of strategic therapy. But I know in our own experience, when we get into a frame of mind that we are totally, absolutely, totally responsible for any change in the family, it becomes pretty heavy. And I know that I become less flexible, more worried, and therefore probably less in touch with my own resources as a therapist.
In addition, it's possible to assume so much responsibility for the change that the family or the individual takes the complement of that. In other words, they assume less. So what you have is a situation where, as a result of assuming too much responsibility for change on the part of the strategic therapist, the family will actually assume less of the responsibility. And thus the strategic therapist may unwittingly take away some of the initiative from the individual or the family.
And I would like to make a note on paradoxical interventions, that if a student reads the literature on paradox, he or she might get the notion that it's a sort of tricky, cutesy type of intervention where I'm going to say something to the family, quote, so that they will do the opposite. That kind of a frame, I would say, is a power frame, and it could get a therapist into a kind of manipulative frame of being invested in the outcome. I'm going to do this so that they'll do this. And I think that a better way to think about paradoxical prescriptions is to say that you will respect the energy in the system, utilize it, perhaps prescribe it, but with the intent that whatever they do with it is something that I would respect and not be disappointed if they don't do what, quote, I wanted them to do. And I think that's a limitation to think that way.
Another potential side effect or a potential problem with strategic therapy is that you can develop a whole arsenal of techniques and methods that are extremely effective in changing families. And once you use those techniques time and time and time again, the techniques can become stagnant or stale. So they take on a routinized quality to them. And if you look, as we do, of doing this perhaps for the rest of our lives, then your arsenal may not be complete enough such that you can develop a sense of excitement about the process of change. So a technique can become extremely fascinating the first 5, 10 times you use it. The next 20, 30, 40, 50 times, there can be a kind of deadness about it that's not good for the therapist. And it's hard to imagine that the client or the patient would not pick up on that kind of deadness. And eventually the therapist can become quite burned out and see himself or herself as a mechanic, somewhat robotical.
More like a plumber.
More like a plumber taking the life out of what's potentially a very exciting kind of growth process for the therapist.
And perhaps as a final note, since strategic therapy grew out partially as a response or in contrast to psychoanalysis, where everything was thinking about what was going on inside the person. With so much emphasis on interaction and structure, and a lot of almost skepticism about feelings and cognition, that occasionally strategic therapists begin to live in a world as if the self does not exist. There's a kind of negation of the centrality of the self.
So as a reaction to that kind of previous therapy, strategic therapists may have gone too far in negating the self, in effect, and negating some of the useful aspects of self-psychology.
And I would just like to make a plug for the notion that self and system are two different levels of the same reality, and that they both co-evolve together, and therefore I would like my theory to be much more sensitive to self as I continue to be sensitive to the dance between and among selves.
I think without question, in summary, strategic therapy has made an enormous contribution to the field of psychotherapy. That their achievements, the theory will live on, but that it's still a limited kind of model, and that it's left up for future theoreticians, modelers to go ahead and take the strategic paradigm and improve upon it. Because I think in and of itself, it's a limited paradigm, while at the same time recognizing that it was an enormous improvement over previous methods of psychotherapy and change.
And it is a strategy or a paradigm that can be incorporated in an integrative way with other models of family therapy. What it does is it really highlights for me the importance of the therapeutic system, but that within that frame, I think one can use other forms of theory to understand the system perhaps better. One can take structural therapy, Bowenian therapy, other forms of understanding the system, and then move on to strategic therapy to answer the question, how does the therapist position himself or herself in order to help this family move from point A to point B?